Good afternoon, ma'am. I'm Arden Elizabeth CASILI from BSN 2C Group 5, and today I'm going to do the return demonstration of nasogastric tube insertion, Gavage, Lavage, and then the removal. Its purpose is to administer tube feedings and medications to clients unable to eat by mouth or swallow a sufficient diet without aspirating food or fluids into the lungs. Then to establish a means of suctioning stomach contents to prevent gastric distension, nausea, and then vomiting. Then to remove stomach contents for laboratory analysis, and then to gavage or to lavage or wash the stomach in case of poisoning or overdose of medication. Next is the assessment. For the assessment, first is to assess the client's for history of nasal surgery or deviated septum, then also the patency of nares, then the presence of gag reflex, and then also the mental status or ability to cooperate with the procedure. For the planning, first is we need to determine the size of the tube to be inserted, and then whether the tube is attached to the suction. Then, for the preparation is to assist the client into a high Fowler's position, and then if health condition permits, and support the head with pillow, and then place a towel or disposable pads across the client's chest. After doing the planning and the preparation, I will now proceed to do the procedure. First is to confirm the client's, I mean the doctor's order, and then identify the patient, introduce yourself to the patient, and then explain the procedure, perform hand washing and other infection control procedure, and then done the appropriate PPE, and also prepare the needed equipments. Then after that, position the patient into a high Fowler's position, assuming that my patient is already in a high Fowler's position. Then I'm now going to place a towel or absorbent pad into the patient's chest. Then after that, I will now select the appropriate size of the tube. I will now select the appropriate size of the tube. Then, I will now determine the appropriate length. For my adult patient, assuming that this is a tube, then to determine the length, I will measure the tip of the client's nose to the tip of the client's ears. And then to the xiphoid access. After that, I will just put micropore tape into the tube for me to know the proper length. Then I will now cleanse and I will now cleanse and dry the bridge of the nose and then apply skin protection. Assuming that I'm cleaning my client's nose to prevent any infection or any discomfort while inserting the tube. Then, I will now examine my client's nose to nostrils for any deformity or obstruction. Then, after that, I will now lubricate the tube, and then with water-soluble lubricant. I will now flex the client's head forward, and then tilt the tip of the nose. I will tilt the tip of the nose upward, and then pass the tube gently into the nose as far as the throat. Guide the tube. I will guide the tube. Okay? Kunwari, na-insert ko na siya. Hanggang nasopharynx. Once the tube reaches the nasopharynx, allow the client to lower his head slightly. Okay, lower your head po. Then after the tube reaches the nasopharynx, allow the client to swallow. Instruct the client to swallow. Okay, sir, inom ka po habang ini-insert ko po itong. If obstruction is felt, pull up the tube and then try the other nostril if there is obstruction. Pull. Then put to the other nostril. Then advance the tube up until the mark, or the one that I put micropore tape. Up until the second process of the client. Here. Then after that, check the back of the client's throat to make sure that the tube is not curled into the throat. Okay, open ko ng yung. Okay. And then check the correct placement of the nasogastric tube by aspirating stomach contents. By aspirating stomach contents. I will use this one to aspirate. Assuming that naka-aspirate po, and then check the pH of the stomach content, and then also check the stomach area while check or auscultate the stomach area while I put air for any whooshing sound. Okay, assuming that I already hear the whooshing sound, and then confirm by X-ray. Then after that, secure the tube by placing micropore tape if it is in the proper placement already. Then connect the tube to the drainage. And then feed as ordered. And then after that, fasten the tube loosely to adult client's gown with safety pin, or just put micropore tape into the patient's gown. Then assist the client into a comfortable position, and then administer oral hygiene, and then clean the tubing on the nostril, and then remove the gloves, and then perform hand hygiene, and then record the procedure. I will now proceed to do the nasogastric tube feeding, or the Gavage. First is to confirm the physician's order, then identify the patient, introduce yourself to the patient, then explain the procedure, then provides for client's privacy, and then perform hand washing, and then done the appropriate personal protective equipment. Then, assuming that I've already put on clean gloves or sterile gloves, then I will now prepare the needed equipment. Next is to prepare the formula, also to check for the expiration date, assuming that this is the formula in the hospital or anything. Then check the expiration date, and then shake thoroughly. Then also always check the position of the client. Make sure that the client is always in high Fowler's position to prevent aspiration, especially when feeding. And then confirm the correct placement of the NGT every shift prior to medication administration, or prior to each bolus feed and PRN, based on the client's assessment, by 2 or more of the following, by to check the correct placement by aspirating, and then by putting air, and then auscultation, and then also check x-ray. I'm just gonna do the auscultation. I'm going to put air. And then check for the whoosing sound. Then, I will now aspirate for the, after that I confirm that the NGT tube is in the right position, I will aspirate to check the stomach contents. To do this, I'm just gonna use this one to aspirate. Then, assuming that yung aspirate ko is same as the prepared food, I will now flush it with 25 ml of water. Then, after flushing 25 ml of water, I will now administer the feed, or the ready-made feed appropriate for the client. Ipopor ko na yung feed, yung food, ready-made food, and then like this. And then kapag paubos na is i-refillan ko na lang po. And then assuming that tapos na, then I will now flush it again. And then I will instruct the client to, or the significant other to keep the client, make sure that the client's head is elevated for 20 to 30 minutes to prevent aspirations. And then rinse the bag and the tubing with warm water whenever the feedings are interrupted. If interrupted lang naman. And then, after that, ilalak na lang po yung NGT tube. Then, for client's comfort. And then, I will now dispose the supplies and then perform hand hygiene and then document the feed hung and then the flush amount. I will now proceed to do the lavage. First is to confirm the physician's order, then identify the patient, introduce yourself to the patient, and then provide for client's privacy, explain the procedure, perform hand hygiene properly, and then don the appropriate personal protective equipment, and then prepare the needed materials and equipments to be used. And then position the client into a proper position and then place the emesis basin anywhere near the client. And then drape the patient with towels or paper chalks to absorb any drainage. Then verify the tube placement by aspirating stomach contents. To do this, attach a septic syringe at the end of the tube and then aspirate gastric contents. Assuming na aspirate na. And then place 10 to 50 ml of air in a syringe and then inject it into the tube. Assuming. And then simultaneously auscultate to the area. 50 ml of air. And then auscultate the epigastric area. Then after that, ask the client to speak. Okay. Next is to place the stomach contents into a specimen or proper specimen container for examination by the physician. And then instill lavage solution again, assuming that it has a normal saline solution for lavage. I'm gonna put normal saline solution. And then remove the lavage solution using the technique earlier, and then just repeat just continue and repeat the lavage procedure until the stomach contents returns to clear and then the prescribed amount of solution has been used. And then continually observe the client for cyanosis, increased aspirations, Gargling and attempts to vomit. Then, when lavage is complete, clamp the tube to determine, I mean, for the for it to remain in place. When the tube is to be removed, clamp or pinch off the tube, and then just withdraw it quickly and then smoothly, and then place it in the basin. Next is to remove all the used equipments from the bedside, and then measure the total lavage in return. Estimate the amount, the stomach contents by subtracting it to the solution, and then record it for the input and then the output. Next is to discard the lavage solution, this normal saline solution, and then dispose the equipments, and then assist the patient into a comfortable position, and then administer the oral hygiene. Okay, sir, yeah, assuming na nai-assist ko na into a comfortable position, and then I will now do the hand washing, and then record the procedure into the patient's nursing notes. Okay, I will now proceed to do the nasogastric tube removal. First is to confirm the physician's order, identify the patient, introduce yourself, verify the client's identity, provide for client's privacy, explain the procedure, perform hand washing, and then don the appropriate personal protective equipment, then perform the gloves, etc. And then prepare the needed equipments. Then place a towel again across the client's chest, and then flush the tube with 5 to 10 ml of normal saline. Open, and then assuming that this is a syringe, just flush it with 5 to 10 ml. Then after that, remove the tape and securement of the device. Remove the tape. Then after that, ask the client to take a deep breath, and then hold the breath if they can, or exhale slowly. Okay, sir, kapag tatanggalin ko na po itong NGT tube nyo, hinga lang po kayo ng malalim. Hinga lang po ng malalim. Okay. Remove with tissue. Then just remove it quickly. Then place the NGT into a disposable garbage bag with the gloves. Then assist the client with thorough mouth and nasal care, and then after that, assist the client into a comfortable position.